Hi guys. Welcome to my channel. Before we get started, make sure to hit that like button, also subscribe to my channel. Top 10 disadvantages of bad health. So make sure to watch the full video. Top causes of death. According to the CDC, the top 10 causes of death and deaths per year in the United States are: heart disease, 610,000. Cancer, 580,000. Lung disease, 149,000. Accidents, 131,000. Stroke, 444. Flu and pneumonia, 57,000. Kidney disease, 47,000. Suicide, 41,000. These numbers are from the death certificate, which means there is an error. For example, if someone in their 90s had multiple chronic illnesses and died in their sleep, the cause of death listed on the death certificate may be speculative. Top health issues. Compare the list above with the health issues that pop up when surveying large numbers of people. For example, Gallup's annual poll asks U.S. adults to identify their top health concerns. In the November 2015 survey, cost and access to care were top priorities, as they have been for many years. Regarding disease, the most frequently mentioned concerns are: obesity, 15%. Cancer, 14%. Diabetes, 2%. Drug and alcohol abuse, 2%. Heart disease, 1%. Flu, 1%. Mental illness, 1%. AIDS, 1%. Amazing. In addition, many of the leading causes of death are not even on this list, and very few are registered. Perhaps study participants are thinking more about conditions that cause suffering and poor quality of life than death. Alternatively, causes of death that primarily affect older people, such as stroke, may not be as important to the general public as those that affect younger people. Important reason. It is not surprising that the leading causes of death vary by location. However, this means that the actions you should take to improve your health may not be the same everywhere. Healthcare in Pakistan. Pakistan has more than 60 million people living below the poverty line. With limited financial resources, these people cannot even meet their basic needs. Also, even if you are diagnosed with an illness, you have nowhere to go. Local hospitals, nurses, and doctors are not enough to care for all of Pakistan's underprivileged population. In Pakistan, the government does not make healthcare a priority. Local hospitals treat the poor free of charge but lack the resources to serve many people at the same time. Even patients who need surgical treatment at local hospitals have to wait a long time because of the waiting list. By the time it's their turn, the patient will die or get worse. In Pakistan, he has more than 2 million surgeries outstanding, and the number is increasing day by day. Health problems in Pakistan. On the other hand, people in rural areas are unaware of their illness and are unable to receive proper treatment. Many diseases are prevalent in Pakistan, mostly affecting the poor. The main reasons are lack of awareness and funding. Below is a list of major health problems in Pakistan. 16. Mental health. About 60 million people in Pakistan suffer from mental disorders. Few cases have been reported, but Pakistan lacks advanced medical facilities for the mentally ill and is not being treated adequately. 15. Malaria. Most of the people living in slums suffer from malaria. The disease is caused by mosquito breeding in dirty water and unsanitary conditions, which are very common in rural areas. Malaria can also be fatal if left untreated. This is one of the biggest health problems in Pakistan. 14. Tuberculosis. Tuberculosis is another serious disease that affects many people in Pakistan. According to the World Health Organization, WHO, Pakistan is one of the 5 countries with the highest susceptibility to tuberculosis. The disease is spread by sneezing and coughing and can be fatal if not treated in time. 13. Dengue. Dengue has been affecting people since 2010. Thousands of people have died in Pakistan's rural areas. Dengue fever is a viral infection caused by certain types of mosquitoes. It causes fever, severe headache, and weakness in the patient. Many years later, dengue fever is still rampant across the country. 12. Cancer. Cancer is another deadly disease that is one of the leading killers in Pakistan. The 2 main types of cancer prevalent in Pakistan are breast cancer and lung cancer. More than 40,000 women die from breast cancer in Pakistan each year. Lacking awareness and adequate medical facilities, cancer is growing at an alarming rate in Pakistan. On the other hand, Pakistan is the largest tobacco user in South Asia, so smoking is the main cause of lung cancer. 11. Ischemic heart disease. Ischemic heart disease is one of the deadliest diseases in Pakistan. Factors such as pollution, unhealthy diet, dirty water, and smoking cause this heart disease. In Pakistan's rural and slum areas, there are not enough resources for people to self-medicate when suffering from heart disease, which can lead to further health problems and even death. Pen stroke. About 350,000 cases of stroke are reported each year in Pakistan. Stroke is one of the leading causes of death in Pakistan. Not only depressive symptoms in particular, but also chronic stress in life increases the risk of stroke and transient ischemic attacks in older people. To avoid stroke, we need a better understanding of important and potentially modifiable risk factors for stroke, such as patient stress and negative emotions. 9. Diabetes. Currently, in Pakistan, he has more than 7 million people suffering from diabetes. Due to a lack of nutritious food and awareness, the number of diabetic patients in the country is increasing. According to the study, by 2030, Pakistan will be one of the top 5 countries with the highest number of people with diabetes in the world. 8. Hepatitis, the most common health problem in Pakistan. Hepatitis A and E are caused by eating unhealthy food and drinking dirty water. Hepatitis is increasing day by day as sanitary conditions in Pakistan's rural and slum areas are far from satisfactory. Symptoms of such hepatitis include diarrhea, jaundice, and fever. Hepatitis E also affects the urinary tract in the body. On the other hand, hepatitis B and hepatitis C are also very common across Pakistan. Hepatitis B and C are caused by blood transfusions and sharing of equipment such as razors, toothbrushes, and other household items. 7. HIV/AIDS. UNAIDS estimates that there are approximately 100,000 HIV-positive people in Pakistan. The main cause of the disease in Pakistan is the use of infected syringes by drug addicts. Sindh, with more than 50,000 of her patients, has the highest HIV prevalence. The government must take serious steps to prevent HIV/AIDS in Pakistan as the number of sick people increases at an alarming rate each year. 6. Maternal and child health. Maternal and child health is a serious problem, more prevalent in rural than urban areas. Lacking proper nutrition, awareness, and treatment, rural women suffer during pregnancy, resulting in poor health of their babies. Babies are often stillborn or suffer from mild to severe birth defects. Maternal and child health is one of the most serious health problems in Pakistan and requires urgent attention. 5. Acute respiratory infections. Acute respiratory infections are the leading cause of death among children in Pakistan. Malnutrition, lack of vaccines, and lack of awareness are the main causes of this infectious disease. In rural Pakistan, women are unable to feed their children adequately due to a lack of financial resources. This causes many health complications for children. 4. Hypertension. About 20% of Pakistan's total population suffers from hypertension, making him one of Pakistan's major health problems. People with high blood pressure don't get treatment because they don't have money. Left untreated, high blood pressure can lead to other serious health problems, such as stroke, heart disease, and kidney disease. 3. Asthma. About 7% of Pakistan's population suffers from asthma, and this proportion is expected to increase in the coming years. The main causes of asthma are smoke, dust, and pollution. There is no cure for asthma, but with proper treatment, people can lead normal problem-free lives. 2. Diarrhea. Diarrhea kills more than 300,000 children in Pakistan each year. Children in rural areas especially suffer from this disease due to unhealthy diets and unsanitary living conditions. Due to limited financial resources, these children's families are unable to provide them with treatment. Thousands of children die from diarrhea in rural areas due to these conditions. Diarrhea is one of the major health problems in Pakistan. 1. Telemedicine. Telemedicine has been on the market for over 40 years, but it has fully blossomed today with the advent of online video conferencing, smartphones, wireless devices, and wearables. The term refers to the use of technology to provide remote clinical services. Used for primary consultation and initial diagnosis, remote patient monitoring, and medical education for health professionals. More specific applications include telesurgery. Physicians can use robots and fast real-time data transfer to perform surgery without being physically present with the patient. Physicians use telemedicine to create personalized treatment plans and prevent hospitalizations and readmissions. Such use of health data analytics can be related to the use of predictive analytics seen previously. This allows physicians to proactively anticipate acute medical events and prevent patient deterioration. By moving patients away from the hospital, Telemedicine helps reduce costs and improve service quality. Patients can avoid waiting and doctors don't waste time on unnecessary consultations and paperwork. Telemedicine also improves the availability of care, as patients can be monitored and consulted anytime, anywhere. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go.